My name is Kevin Hare. I'm a filmmaker and photographer. I've been working with the Georgian Bay General Hospital Foundation now for a number of years, and since the beginning I always had the idea of doing a project that gave people a bit of an inside view inside the hospital, specifically the emergency department. Originally, this project was supposed to be pretty straightforward. I was going to follow around a couple of nurses and document their day-to-day tasks and give, as I mentioned, people an idea as to the things that they deal with on their regular shifts. After spending a little bit of time with them, I very quickly realized there's no such thing as a regular day or a day-to-day task list or anything that resembles a normal day for them. That's when the project kind of escalated, and I realized that this was going to be something really fantastic to show exactly what happens in this department and how incredible these people are. I met two incredible young people that hopefully this project gives you some indication as to how amazing these people are. These are two of many, and I think they deserve a ton of respect.
My name is Joel. I'm a registered nurse in the emergency department here at GBGH.
So my name is Kaitlin. I am a registered nurse in Emerge here in Midland. I've been a nurse since 2018, and I've been in Emerge for the past 2 years. On a typical day, we come into Emerge and we drop our stuff off and go get report. We do transfer of care, so the night shift leaving can give us report, and then we take over those patients.
So she has chronic nausea, vomiting related to anxiety.
We kind of go through and make a plan, what needs to be done, what hasn't been done, and then while that's being done, people are still coming into Emerge. It doesn't stop. It's 24 hours a day, so there could be a lineup in the waiting room, so you have to start bringing people in and coordinating where they're going to go. And then you are working with the doctor that arrives on shift as well at 7 a.m. to make a plan of care for patients that have been there overnight that still need things done.
So common things are just a lot of assessments, so like listening to people's lungs, using your stethoscope, talking to the patients, understanding why they're here, getting a background. I always like to, even though we have the triage reports, I always like talking to the person to get a proper story myself, because sometimes you can get things that they didn't mention before.
Hello. Well, sorry for the long wait there.
A lot of blood work, collecting samples, things like that to send down to the lab, and lots of charting. So, yeah.
Some quick charting people's vital signs before it gets later in the day. It usually gets a little busier, so trying to get ahead of it before I get too far behind.
Attention all staff, protecting cold blue, ICU, stand for. You can still stay.
So a code blue, when that's paged overhead in the hospital, it can mean cardiac arrest or respiratory arrest. It really means that that patient is no longer breathing or doesn't have a heartbeat.
In the emergency room, it's seen a lot more common than other departments just because we're always the first point of contact. So if somebody comes in from the community and they have had arrest, then they come to us. So we see it it's pretty common for us. So you always try to divide your roles up as best as possible. So you team lead, person giving medication, person doing CPR, so everybody knows what they're doing. So the code generally runs smoothly.
So I quickly learned everything that needs to happen. When a code blue is called, it was absolutely incredible to see all of the staff members come together so quickly, and in this case, resulted in a positive outcome. So after that situation, we went back to the nurses' station, and Joel began seeing his patients, doing his rounds, and getting medications, doing blood work, these types of things. At this point, we had spent a little bit of time together, and I had a sense that there was one patient where there might be something going on. Just Joel's body language, I could just tell something was going on. So when he sat down to do some charting, I decided to ask him if he cared to explain what he was doing and what was going on with this specific patient. And I quickly realized that my suspicions were right. And yeah.
Sorry, I'm trying to think of what to say. Basically, came in. Sometimes people, when they have a miscarriage or they're pregnant, usually it happens earlier on in pregnancy, but sometimes it can happen when it's later in the pregnancy. It's quite a traumatic event, lots of emotions involved.
So essentially, we just made sure that her blood levels were okay, that she wasn't bleeding. Also, once she settled a little bit, making sure she can walk, ambulate okay, because if you can't walk or you're fainting, things like that, then we can't send you home, not safely. So once that's our first priority. And then after that, it's also a lot of support, emotional support. Just because they leave the emergency room doesn't mean that their experience of what happened stops. So they have to grieve and they have to go through the whole experience. So just giving them the tools and things that they can to go through it in a healthy way. And also, unfortunately, because of the baby, what to do, what their wishes are for the remains and things like that. So helping them all figure that out and giving them time to do so as well. We just, whenever there's a pregnancy loss or infant loss, anything like that, we just we try to give as many memories as possible to the family. So here we have a bracelet that basically you put their name on. I have just some information, just their name, their height, their measurement, things like that, and just a bunny here, just so they can have as many memories as possible with their child. Yeah.
In Emerge, we do see a lot of trauma and dramatic things that normal people on a daily basis don't see. It's tough because we try not to take these things home and leave them at work, but sometimes we can. So we use the support of our colleagues. We do debriefing sessions with the team to really talk about it.
For me, it's a lot of relying on colleagues, kind of having those conversations, because fortunately, if you don't really live it every day and it's not your daily life, even if you go home to friends and family, a lot of people just don't understand, which it'd be hard to understand if you don't live it. So just talking with your coworkers, relying on them, because a lot of them have lived similar experiences and kind of know what it's like. But also it's a skill, but learning to kind of separate work and life, which is easier said than done sometimes. Sometimes it's just that 5-minute conversation with the person sitting next to you, and then you move on and go on your day. But yeah, it's not always easy, but we get through it.
When traumatic things happen in the Emerge department, we don't stop. We are continuously going to the next patient, the next room, the next task. Someone else has come in and someone else needs our assistance. So it is tough to try and recover from that, but we just take a second and then we have to move on with things. It is part of the job, and we just have to remember, like, someone else needs us now, and we give our compassion, our time to that individual, and we just have to kind of pull it together and we go on to the next.
So after learning of this situation, it really put a lot of things into perspective for me. I mean, I was having a hard time just dealing with my own emotions and thoughts about what was going on. And these people just have to carry on and have to go see other patients and you know, they're doing all types of things. They're getting medication, they're doing blood work, they're cleaning rooms, they're charting. It's just incredible that they are able to go from these incredibly tough situations and then right back in giving the best care to the next patient. Amongst all of the things going on and beeps and monitors and phones and multitasking, there was a pretty distinct ring that went off. It got the attention of a couple nurses that were sitting at the nurses' station.
We have a pager phone at the nurses' station. What it does essentially is just when EMS or the ambulances are coming in with someone, they give us a heads up. So say if it's a code blue or somebody they are doing CPR, then they can give us a shout out to let us know what what's coming in so we can prepare adequately. So they gave us a patch. We got a patch. So we answered, and it was an individual in the community who had suicidal thoughts and attempted to commit suicide.
So we just got somebody come in by EMS. They come in we see a variety. So people come in for physical ailments, also mental health, and sometimes it can coincide. So essentially when they came in by EMS, we got, like I said before, the warning from the ambulance saying that they were coming in. So we were able to prepare. So when he came in, again, assess and see, first of all, physically, is there any danger to their life? Like, what's the priority? So fortunately, this individual was physically okay. So now we're more focusing on the mental health aspect.
The person was assessed by the doctor and then unfortunately was placed on what we call a Form 1, which is just basically this person has to stay in hospital till they see a psychiatrist. So from there, sometimes patient doesn't always receive that news very well. And when somebody becomes a danger to either themselves or somebody else, as happened in this situation, we often move them to what we call our safe rooms.
What's the safe room?
Those are for our mental health patients who are a risk to themselves and others. It's a locked rooms. They can come in and out of that area, but they can't come out into the emerge department. So it's usually held until they are transferred to Waypoint or a psychiatry to see a psychiatrist, a facility that has one.
In our community, especially with COVID right now, we are seeing a rising number in those with mental health issues, both being pediatric and anywhere from middle-aged to older adults. It's very prevalent right now, and unfortunately, the system for mental health is not necessarily broken, but we don't have all the resources we want right now. So patients come to emerge, and if they are suicidal or actively have a plan in place, we do have to keep them here for their safety. And we don't have a psychiatrist here, so it's really tough because we have to send them to another facility. And those patients a lot of the time are not on medications and get very aggressive, and they can't help it, but it's something that we also have to deal with here in Emerge, and we aren't fully equipped, but there's no other solution for them other than to come to Emerge.
So when I started in the Emerge, I was honestly quite surprised of how much mental health you see in the emergency room. We see it quite often, especially since COVID started. Mental health has become such a big need, especially even in this community. So we see it quite often, and people come in with quite a variety of mental health issues. So it's definitely an important need in our community, and I think it's one that we don't talk about enough for the amount of times we see it.
With our growing population, it continues to grow, and unfortunately our hospital is not continuing to grow with the population. That being said, the staff, we work to give the best possible care to patients, and sometimes it is tough when we don't have the space available.
So a lot of the time when people are wondering what's the wait, what's going on, and we look busy, but the rooms are full, so it's hard. Like when people are in the waiting room to come in, there's just nowhere to put them right now because we walked into a full department.
Unfortunately, one of our issues in the emergency room is just the space or the lack of rooms we have for patients. Especially with COVID, people coming in, we see the influx of, like in the flu seasons, we see people coming in with COVID symptoms, plus the flu, and even in the summer, we have our population in our area does grow.
Moving forward, I think we definitely need more staff. We can have more beds, but if we don't have the staff needed to take care of these patients, a bed is a bed, and there is no nurse to take care of that patient. We are experiencing a worldwide nursing shortage. Globally, internationally, there is not enough nurses, and we have lost a lot with COVID.
The goal would be to expand our emergency room just to compensate for the influx of patients / population. However, with just the provincial nursing shortage, fortunately, if you have more space, you need more staff. So ideally would be a lower nurse to patient ratio.
In Emerge, sometimes we get those patients who they hit you in the right place. They They just tell you that you're doing a great job and they're very thankful for your care. And when it's a high stress day and you just have all this unpredictability coming in and you just feel like what else could happen, and you have someone say like, thank you for what you do, it means a lot.
When you have a patient that says thank you or just is grateful, kind of just makes it worthwhile. More often than not, you always remember the people that are not so nice or ungrateful. So when you get somebody that says just a thank you or you did a great job or things like that, it just kind of reminds you why you got into it, and also reminds you that not every day is going to be bad, that you do get some good experiences and some good days. So yeah.
When we receive donations through the Heartfelt Thanks program here at GBGH, it means a lot. It's really nice to have that recognition and know that someone was happy with their care, that they made a donation to this hospital. And this is not only helping us as nurses, but patients as well in care, because it's going to resources, equipment, technology, things that we need to just improve patient care and improve their experience here in the ED.
When I walked out the doors at the end of that shift, I was physically and mentally spent. To say I have a newfound level of respect for these people would be an immense understatement. They are some of the most resilient people I have ever met, and I feel incredibly fortunate to have people like this working at our hospital. It's just incredible.
I get to do a lot of things that most people don't get to do, and I get to call it a job. So yeah, I really enjoy it, and I wouldn't want to do anything else.
Despite all the hardships and stress of this job, I don't think I could see myself doing anything else.